Welcome everybody. Thank you so much for joining us, and really are excited to talk to all of you and catch you up a little bit on what we've been up to here at the databanks. Why did we schedule this for today? Well, for those of you that have been involved in some of the compliance efforts, which is many of you, we wanted to give you an update as to how things are going. So with me in the room here is most of the databank's compliance branch. We're going to be walking through several things today. One, a little bit of a status of how we're doing so far in our compliance efforts, but really to spend the bulk of the time talking with you and engaging in a discussion. Some about things that we've seen, that issues that we've worked through with certain boards, and wanted to share some of that information with a broader audience. In the past year, a little more than a year, we've really been focused in compliance with state licensing and certification boards in two areas. About 6 months ago, we first implemented our attestation process, which I know many of you have been through. Just a quick summary is that we ask for you during your registration or immediately following your 2-year registration renewal cycle to attest to that you're submitting reports on the various professions that you're responsible for regulating. We ask what the professions are, and then again ask you to attest. And the attestation is done for those professions that are not covered by our adverse action comparison process. And the most recent flavor of that we started a little over a year ago. We had a webinar which many of you attended a little over a year ago, where we introduced that process. So we won't go into the details about it, but suffice it to say it's been a year. We've done 2 postings. We've gone through half of the states in the country, so we've hit half of you, and the other half either we're working with you now or we will be hitting you up in about 6 months. So just wanted to kind of catch everybody up as to where we are, and for state licensing boards, those are really the 2 efforts we're focusing on right now. For the top 12 most queried professions and the associated professions that support those, we're doing the adverse action comparison process. For everything else, we're going through and asking you to go through an attestation process. So where are we? Just wanted to give a little bit about our results here. On the left side, a little bit of our attestation as of October of 2013, which was a little less than a 6-month period, since you all are required to renew every 2 years. So we hit approximately a quarter of the board or of the profession. So if you look at this graph, you can see we've had some really great results, and you guys have helped us deliver some great results. Over 97% of you have attested to your various professions, which is great, and that total professions is almost 400. So really thank you very much for your support there. Those that could not attest or failed to attest, we may be reaching back out to you to discuss some of those in the future, but we're going to continue to monitor this, and if ever you have any questions as you're doing that or need any help, please don't hesitate to give us a call. Contact your compliance officer. On the right side, those are as of October 2013, the results of the state board adverse action comparison efforts, just those we did in 2013. So just what we call of our 4-semester cycle, just semesters 1 and 2. And we looked at 778 professions in that year, which is an awful lot. Again, we had some really great results and worked with you to get approximately 91.5% of those professions compliant. Not quite 5%, another 2%, almost 7%. We're still working with you or reviewing materials in one form or another, and look forward to moving all those to compliant and getting up into the upper 90 percentile as we move forward. So again, just thank you all for your efforts on that. The next slide here talks a little bit about the impact that we've had. And when we look at what we're doing in compliance, we try to look at the so what of it. And one of the things we're looking at is, as a result of these efforts, we're generating additional reports in the databank, which is great for all those that are querying. We want to make sure that the information that is supposed to be in there is in there. And we really see it as our job in the compliance branch here at the databank to help you to meet your reporting requirements, to meet your federal obligations. That's what we're here for. We're here to help you guys achieve those results and be able to get that. So if you look, we've had over over 3,000 new reports go in the last year alone. Actually, I know we have quite a few more pending that we expect to come in the next few months. And those reports are being disclosed. And that's really what this is all about. The whole point of getting the report in the data bank is not just so that it sits there, it's so that anybody querying on that individual practitioner has the knowledge of what you reported so that they can make a good decision, whether it be for licensing or for employment or privileging in a hospital, whatever that might be. The last thing I wanted to kind of push out there before we start talking about some of the specific things we saw is about our guidebook. As I think everybody knows, the two data banks, the National Practitioner Data Bank, or NPDB, and the Health Integrity and Protection Data Bank, or HIPDB, merged back in May. And we've been working feverishly, I would say since then, but that would be lying, before then, to consolidate all of the information and update our guidebook. There's a draft of it currently. It's been completely updated and incorporates the merged information, so things relevant to the underlying statutes that govern the NPDB, and which formerly governed both. There's a lot more examples. We think it's a lot clearer. There are links. With that, I turn it over to Molly.
Thanks, Dave. Okay, so let's get into some of the specific topics. We have a list of questions about, are certain things reportable? And, that's really the bulk of the work that many of us in the compliance branch do on a daily basis, as we engage with you in discussions about certain actions that your boards are taking and whether or not they're reportable and how they're reportable. So this is an opportunity to talk a little bit more about those. So my colleague Dana is going to talk first about cease and desist orders.
Thank you, Molly. It's a pleasure to speak with you today. Good afternoon to everyone, and I will talk a little bit about cease and desist orders. So the question is, are cease and desist orders reportable to the data bank? Yes, they are. An example of this is when the board takes a cease and desist order or action, against an unlicensed individual who is holding himself or herself out to be licensed or otherwise authorized by the healthcare services. And because NPDB regulations define a healthcare practitioner as an individual who is licensed or otherwise authorized by a state to provide healthcare services, if the state issues a cease and desist action against an unlicensed individual, that action must be reported to the data bank within 30 days of the date the action was taken. So I just want to talk a little bit about reporting the cease and desist actions. Currently, we totally recognize that there is no adverse action code for reporting specifically cease and desist. There's no code that specifically says cease and desist as an adverse action code. So we're asking, when you report your cease and desist actions against an unlicensed individual, please use the adverse action code other licensure action not classified, and the basis for action code practicing without a license. On the licensure information screen, please select no license, and in the occupation field of licensure category, select the field of licensure claimed by the individual. Also, we wanted to bring your attention to, we realize that you may not have all of the necessary data elements to submit the cease and desist report to the data bank, such as date of birth, school, year of graduation. The data bank customer service department can provide what's called alternate data for any of those missing data elements that you have. The customer service department can be reached at 1-800-767-6732, and we will provide that number to you later on during this presentation as well. So the data bank does encourage the board to request alternate data to use versus not submitting the report because you don't have all of the data. And lastly, I would just like to say that we have received feedback from our data bank users regarding the adverse action code specifically for cease and desist. And we want to let you know we've heard you. We appreciate that feedback, and discussions are in place to add that code in the near future.
Great. Thanks, Dana. Dana mentioned an important point about calling customer service if you're missing a data element, because we don't want you to get those rejections for the reports that you're submitting. And that alternate data is not just about cease and desist. You can obtain that information for any reports that you're submitting on any reportable action by calling customer service. So please take advantage of that option. Bridget is now going to address whether or not reporting on deceased practitioners is reportable, and talk a little bit about consent agreements.
Oh, thank you, Molly. Good afternoon. My name is Bridget Johnson, and I will talk a little bit about reporting on deceased practitioners and consent agreements. Are they reportable? Is a deceased practitioner reportable to the data bank? The answer is yes. Reports concerning deceased practitioners must be reported to the National Practitioner Data Bank. One good example is that a fraudulent practitioner could assume the identity of a deceased practitioner. One of the practical objectives of the National Practitioner Data Bank is to restrict the ability of incompetent physicians, dentists, and other healthcare practitioners to move from state to state without disclosure or discovery of their damaging or incompetent performances. So when you submit a report on the deceased practitioner, please indicate that the practitioner is deceased in the appropriate data field. These actions should be reported within 30 days when the action was taken. The next question is a consent agreement reportable to the data bank? Any state licensure or certification action that meets the National Practitioners Data Bank reporting requirements must be reported, regardless of whether the action was imposed through a board order, a consent agreement, or other method. It is the action itself, rather than the method by which the action was taken, that determines whether the action must be reported. For example, if the state licensing board issues a reprimand through a consent agreement, the reprimand is reportable. And once again, these actions must be reported within 30 days of when the action was taken. Thank you.
And just to summarize it so we don't take up too much time on this, is that it basically boils down to the vehicle that you use to make an action or to impose an action doesn't matter to us, essentially. If it's a board order, consent agreement, consent order, whatever it is, it's the content of what's inside that makes the difference. So if you have a consent order and there are no reportable actions in that consent order, then that's not reportable. But a consent order itself does not make something reportable or not reportable. It's the contents of it, and that vehicle doesn't matter.
So next, Margie is going to talk a bit about denial of reinstatement.
Thanks, Molly.
Sure.
I'm talking about denials of reinstatement. This is one of the ones that's a sometimes yes and sometimes no, which is pretty common for a lot of the things that we report. If you have an individual and they're asking for their license to be reinstated, if the board answers that they can't and they add conditions for the individual to meet or remove the conditions, then the denial is reportable. This would be reported as a revision to the initial report. You'd go into the data bank and you'd look for that initial report, whether it be a suspension or probation, and you'd go ahead and issue a revision to that one. If the board answers no, but doesn't add anything, doesn't modify that previous action or order, then it wouldn't be reportable. In summary, there's changes to the order, those changes need to be reported. You have to report it as a revision to that original report. If there's no modification, then you just said no to that reinstatement. There's nothing to report because that prior action is here. It's still reflected in that initial report that you submitted. An example, if you have a pharmacist that's suspended and they request a full reinstatement from the board denies that reinstatement, but they say that the pharmacist can practice for 20 hours under direct supervision of a licensed pharmacist. That would be a change in that original action that was reported to the data bank. You would go into the data bank system, you'd look for that initial suspension, you'd make a revision, and you'd indicate that now they can practice for 20 hours.
Thanks, Margie. Now I get to cover a topic, that being summary or emergency suspensions. So this is one of those issues that may be an issue that came up because we had two data banks for a while. Some of you may know that prior to the merger of the HIPDB and the NPDB, we had different regulations regarding whether an action had to be a final action in order to be reportable, and a summary or emergency suspension is not considered a final action. With the merger of the data banks, it is clear now that actions do not need to be final actions in order to be reportable. So summary or emergency suspensions are reportable, and the actions, again, do not have to be limited to final actions. So if you take a summary or emergency suspension and then you take a subsequent action based on that, a subsequent hearing or a subsequent process, then you would be submitting a revision to action. So you have the initial report, which is the summary suspension, and then you would do a revision to action report on that initial report as you indicate what happens next in your proceedings. I used the term proceedings just then, and so some questions have come up about whether or not a summary suspension that was issued outside of a full evidentiary hearing is reportable. So that gets us into the discussion around the definition of formal proceeding, and we're going to get to that a little bit later in another piece of discussion. But just sort of understand that we have a very broad interpretation of what we mean by formal proceeding. So a summary suspension does not have to go before an entire board for a full hearing in order for it to be considered a formal proceeding and for it to be considered reportable. And so next, Dana is going to talk with us again, and this time about administrative suspensions.
Thank you, Molly. So a little bit about administrative suspensions and revocations. Are they reportable to the data bank? And the answer to that is yes, they are reportable to the data bank. So if the board takes a formal or official action that prevents the practitioner from working, either by suspending or revoking their license, that is a reportable action to the data bank. And an example of this is if the State Department of Revenue issues a notice to the state licensing board informing the board the licensee has failed to submit income tax returns. The board issues an administrative revocation against the practitioner's license because of this. The board should report this action to the data bank within 30 days of the date of action. Another example of this is if the board is notified of a practitioner's failure to pay child support, that's also issues an administrative revocation or suspension. That's also considered a reportable act to the data bank.
Great. Thanks, Dana. Joe is now going to share some information about administrative fines.
So I'll talk a little bit about administrative fines. I will preface this by saying the data bank guidance in the past on admin fines has been as clear as mud, and I think now we have some really firm guidance on the reportability of administrative fines. And I will say that this bullet point is titled administrative fines, but really this is a fine. Whether you call it administrative, you call it a fine, you call it a civil monetary penalty, some sort of monetary penalty is what we're talking about here. And there's really two types that are going to make this reportable. One is that the fine, if your state, your board, consider this to be an adverse action that results from a formal proceeding, so maybe you have a formal disciplinary action, you fine them, you consider that to be an adverse action, that makes it reportable. A second instance could be that maybe you don't call it an adverse action, but it's a negative action on the part of your board or your state. That needs to be publicly available information, and not just meaning it's available on your website, but it is publicly available information in some means. And also, the negative action is either connected to the delivery of health care or taken in conjunction with another action. So for example, what would not be reported to the data bank is if someone sent in maybe post on your website that this practitioner turned in their renewal application late and you fined them $50.
That's not what we're talking about here in terms of a fine. However, they turned in their application late and you reprimanded them because technically they were practicing without a license for a little bit of time. That would be reportable. It's a fine plus another action, that action in that example being the reprimand. Another example of a reportable action could be that you fined a provider $5,000 for failure to properly diagnose a condition in one of their patients. So that would be reportable. You have this fine related to the delivery of health care, the delivery of health care being failure to properly diagnose. Generally, the state, the board, the entity that regulates this profession sort of kind of determines the reportability a little bit of this, but I do want to just caution that it's not so cut and dry that a state just has the authority to say none of this is related to health care delivery or that sort of thing. So something is clearly related to the delivery of health care and there's a fine associated with it, that would be reportable. So a state doesn't just have the authority to say this is none of our fines are related to health care that we're not reporting on. So really it's the two options are if you consider it adverse or if you consider that fine to be a negative action that's either connected to delivery of health care or taken in conjunction with another action.
Okay, well that was a lot, Joe. So thanks. Yeah. Dave's going to talk to us about initial applications and what's reportable and when.
Thanks, Molly. And this is, as Joe mentioned before, there are some areas that sometimes the guidance wasn't very clear. The old guidebooks, I know in some cases were not consistent, and they were old and hadn't been updated with some of the legislation that had been passed. So again, this is one of those opportunities we really want to make sure we put a stake in the ground as best we can. Regarding initial application, so what is reportable? Start with denials. Any application that is denied could potentially be reportable. You have to really look at what was the reason for the denial of application. If it was for some kind of cause, then yes, it's reportable. If it's because of some sort of threshold criteria, it would not be reportable. So I'll give you a couple examples here. If for example, in order to be a nurse, you have to pass the NCLEX nursing examination. If a person applies to your board and hasn't passed the requisite exams, does not have the right degree, something like that, some kind of just base threshold criteria that they don't even get in the door. Those are not reportable to the data bank. If, however, the application is denied for cause, so maybe something that happened in another state, or a criminal conviction, or something else that, if you're denying because of some type of cause, then those are reportable. Now, withdrawals of applications, very similar here. So if somebody withdraws an application because they move and they no longer, are going to live in that state and you haven't ruled yet, and they walk away and say, oh, I'm withdrawing the application, I'm moving. Generally, that wouldn't be reportable. But what is reportable in terms of a withdrawal? When your board would be conducting an investigation into something, or in order to avoid an investigation. Similarly, we'd really consider an abandonment of an application. So if you, to be the same as a withdrawal, generally. If you have an individual and you're investigating them and you tell them they're investigating and then they withdraw or they disappear, generally we're going to consider that to be something reportable. What this really comes down to with this one is how your administrative procedures are handled in your state. I'm aware that some states, if a particular application is not acted upon within a certain amount of time, be it a year, 2 years, what have you, then that's administratively closed. Generally, those are probably not going to be reportable. So really the questions we're asking in terms of denials, withdrawals, abandonments are all around whether or not an investigation was ongoing or the individual was trying to avoid an investigation. Another flavor of this we've seen are boards taking actions before a license is issued. And again, this really depends on how the procedures are set up in your state. If you have the authority, for example, to reprimand an applicant, then, again, depending on how the procedures are set up, generally we would expect something like that to be reported. We have seen other flavors of this where it is there's an order issued by the board saying upon issuing the license, if we choose to issue the license, the applicant will automatically be placed in a probationary period. So nothing has been done yet, but if and when we go forward and give that person the license, they'll be put on probation. The proper timing for that would be upon the issuance of the license. When you put them on probation, that's when you should report it. If you don't give that person a license or still in process, then we would not expect it to be reported. However, again, this really comes down to how your administrative procedures are set up and how you handle applications that are abandoned or not advanced, and it really gets very detailed. So if you have any particular issues, we'd like to talk with you offline about these, because it really gets down into what's the next step in the licensing process and who's supposed to respond, and are you waiting on them or are they waiting on you, and we really want to help walk through that as best as possible.
Okay, then we're gonna keep going, and the next two topics really have to do with some definitions that we've already talked about a little bit. So just to quickly review them, this concept of threshold criteria. It comes up when you're discussing, and this is an issue tied to whether initial applications are denied. So threshold criteria, is what are the conditions that your board puts in place in order for an application to move forward. So if a person has to have so many hours of supervision in their field of practice before an application can be considered, and they don't have that yet, and they haven't met the threshold criteria. It's an objective measure that's applied 100% of the time across the board to all of your applicants. So if you deny based on the person not meeting threshold criteria, that's not a reportable denial of application. So we just want to make sure that that you understand that. Now, if the person has met all the threshold criteria and they have background that you learn on their application, and they've got all the education, they've got all the right credentials, but they've been suspended 3 different times over the last 10 years. Well, that's not threshold criteria. Now you're talking about denial of an application for cause. That's where it gets into the reportable realm. So that I just want to draw that distinction. So that's threshold. And then the other piece is formal proceeding, and we've used that term a bit, and as I've said, we take a fairly we have a very broad definition of formal proceeding. That definition's been around in our guidebooks. It's around in our regulations. The short definition is a formal proceeding means a proceeding held before a state licensing or certification authority, peer review organization, or private accreditation entity that maintains defined rules, policies, or procedures for such a proceeding. So this doesn't mean that it must be a hearing, but that there is some process that you as a licensing or certification authority engage in that has defined rules, policies, or procedures. So again, very broad definition of formal proceeding. So we've tried to be more clear about that, and you'll see as you look at the draft guidebook, you'll see that language again in the draft guidebook. Okay, so moving on, we have a couple of other issues now that we're going to look at, and the next one has to do with licenses issued by political subdivisions of a state. I got to tell you, that's sort of a new topic that's come up for us recently.
So I'll start with the licenses issued by political subdivisions, and then I'll move right into nursing assistants. So licenses issued by a political subdivision of a state. So this really comes right from our definition of a state licensing or certification authority, which includes, but is not limited to, any authority of a state or of a political subdivision thereof responsible for the licensing or certification of healthcare practitioners. So basically, I think I'll answer this with an example. So what has come up is we have a state that does not license or certify massage therapists. There's no state board, there's nothing in the state for massage therapists. However, there is a city in said state that does license or certify massage therapists. So that city needs to register if they have an action to report to the data bank on the massage therapist. So it doesn't have to necessarily be a formal state board that regulates something at a state level. If you have a local ordinance of a city, a county government, whatever, that regulates a healthcare practitioner, that needs to be reported if there is an action to report. So hopefully that helped clarify that a little bit. The next thing I want to talk about is the certified nursing assistants and other registries for healthcare practitioners. Generally, there could be some other healthcare registries out there, but the big one is the Nurse Aid Registry, which sort of transcends a bunch of different federal regulations. So I'll talk a little bit about this because it can be quite messy. So basically, all states have to have a Nurse Aid Registry. The Nurse Aid Registry, long story short, is basically a flagging employment qualification registry of nurse aides in a state. If you're on that, you can't work in a skilled nursing facility and be reimbursed for federal health care dollars. So that's what it is. Now, in a lot of states, I don't have all the numbers offhand, but I think it's about, maybe half the states actually license and certify nurse aides outside of the registry. The other half of the states do not. All they have is a nurse aid registry. So basically, you could have someone who is a nurse aide in the state. They are on the registry. They did something wrong, patient neglect, whatever. They're on the registry. They can't work in a skilled nursing facility. However, they can still work as a CNA in a hospital. So in this instance, this is where a state does not license or certify nurse aides like they would a nurse, a physician, or any other healthcare practitioner. However, there is some type of action that needs to be reported because of the Nurse Aid Registry finding. So that entity, whoever regulates the Nurse Aid Registry, would have to register with the data bank, if not already, and report nurse aid actions as government administrative actions to the data bank. A government administrative action is still an adverse action report. It's just kind of like a report by a different name. It's not a state licensure action, but it is an adverse action report. When you report on a nurse aid action from a nurse aid registry, there is a specific code for employment disqualification based on finding in a state nurse aid registry. So that is the code you would want to pick for that action. So what I just talked about was states that have the nurse aid registry, but they don't license certify nurse aides like other healthcare practitioners in the state. Flip side of this is that you actually have a state that has a nurse aid registry, and the state also licenses and certifies nurse aides. So if nurse aide does something wrong, they get a finding on the nurse aid registry, they can't work in a skilled nursing facility, and the state also licenses and certifies them, they may not work in the state period at all. So what the data bank is saying is that if the entity is one and the same. So, for example, you have a board of nursing in a state. That board of nursing maintains the registry to comply with that aspect of federal law, and they also license and certify nurse aides. That entity, that board of nursing, can report one report to the data bank as a state licensure action if they take a state licensure action, and reference that it was based on a nurse aide registry finding in the report narrative. The reason why I say that is because if you do a state licensure report, you don't get the employment disqualification based on nurse aide registry finding code to pick from. And I also say this as, just because you have a nurse aide registry finding doesn't necessarily mean you're also going to take a licensure action. So this is only true if you take a licensure action. However, that nurse aide registry action still needs to be reported as a government administrative. So you're sort of only getting the one report benefit if you're taking a licensure or certification action on them because of the registry finding. The one other instance that I do want to talk about, and this is, I think, a case in 2 states, so it's very, very minority. There is an entity that maintains the registry and a separate entity that licenses or certifies nurse aides. So if you happen to be one of these 2 states, each entity has to submit a report. The entity that runs the registry has to submit the nurse aide registry finding as a government administrative, and the entity that licenses and certifies nurse aides has to submit the state licensure report if they take an action based on the nurse aide registry. That's sort of nurse aides in a nutshell, and that would be how similar registries for healthcare practitioners would be treated, although they may not be as sort of messy, depending on the other federal regulations governing their practice. If you have any questions about nurse aides, the draft guidebook has some well-worded and crafted and clear guidance. Hopefully that would answer your questions, or you can certainly email one of the compliance officers or give us a call, and we will be glad to walk you through that.
Thanks, Joe. Really, really important. This is something that we have really refined, and you've taken the lead on this, and we all appreciate it.
Right.
So thank you. We want to take just a couple more minutes and talk a little bit about a few more of our processes. So I'm going to turn it over to Dana.
Yes, thank you, Molly. So first of all, we'd like to thank you all for working with us as compliance officers here at the data bank. As Dave mentioned earlier, we, as compliance officers, we reach out to you all for our compliance reviews, and you are very receptive when we either email or call you for information that we need. And so I want to thank you. But as we continue to grow and refine our compliance review processes each time we complete these reviews, I just want to give you a couple of examples of where we are, how we've taken some of our lessons learned and applied those to our reviews as we move forward. The first example that I wanted to give is that we're trying to our best to ensure the professions that we are asking you about are the professions that your state board licenses and regulates. We have worked through our attestation process, as explained earlier, to reach out to you to verify the professions your board regulates, licenses or regulates, as well as when we as compliance officers reach out to you, we're asking those questions about the professions that your board licenses and regulates. So we're really working hard to make sure that we have that information as accurate as possible, and we do appreciate your patience working with us if you're finding that we're asking similar questions, but we're working on a better way to integrate that information, making sure that we're getting that as accurate as possible. Another example of something that we're working toward is those boards that have worked with us for our compliance reviews. Here at the data bank, we are, as compliance officers, we're looking at what are called missing actions. So as we work through our compliance reviews and we find that there may be some actions that should be reported to the data bank, and we're working with our points of contact at the state licensing boards. Before we send those actions out to you to look at and reconcile with the data bank. We're looking at those, we're reviewing those. We want to make sure that what we're sending you is as accurate and complete as possible so that when you get those and you review those, it makes that process easier for you. And so any feedback that you have during the process that we're that we're in with you, if you want to provide that to your compliance officer, please feel free to do so, because again, we are always striving to do better with those things. One other last example I wanted to provide is we recognize that a lot of our boards are utilizing or do utilize the reporting agents such as the National Council of State Boards of Nursing, the National Association of Boards of Pharmacy, the Federation of State Boards of Physical Therapy, Federation of Chiropractic Boards, Social Work, the Association of Social Work Boards, and just want to say that through our compliance reviews, we have developed relationships with the reporting agents used by many of you all, and we are, with the board's approval, we work directly with the reporting agents to complete our compliance reviews. So we really are appreciative of being able to work with the reporting agents with your approval. So those are just a couple of highlights I wanted to bring up to say we thank you again for your working with us through our compliance reviews. And if you have any feedback, please feel free to let us know about that.
Hi, my name is Lorraine Lockett-Amechi, and just going to follow up on what Dana was saying. One point of feedback that we received from our user community is that they wanted to have some sort of mechanism to work through the actions, and we came up with the compliance portal page. So that was a bit of feedback in action where we'll take this portal and we'll work through the missing compliance actions. What the portal allows us to do is to send individual messages about the actions and clear up any outstanding actions, or allow entities to kind of work on a collective action plan to catch up on their reporting requirements. Another thing that they're able to do there is their attestation. And what an attestation is every 2 years the board will attest to submitting all reports or actions. So as we said, we really do like to hear back from you and receive feedback. And as we receive that feedback, we really try to take heart to it, turn it around, and figure out how we can provide a better service to our entity community. So as a result of all that work between the entities and the boards, we will eventually work to status each profession. And what that means is after the compliance reviews, the results are posted to the DataBank public website. We post every October and April of each year. Perhaps you've seen our compliance data. You can obtain this information by state through an interactive map by the profession following the links on our website. For more information about reporting compliance processes, definitions, terms, or NPDB, research statistics, please refer to the website.
One of the other areas of our process that we've tried to refine, and I think we're doing a pretty good job of, is for those boards that work with agents. We have agents for a number of the professions: nursing, chiropractic, physical therapy, social work, and pharmacy. Thank you. And so part of what we're doing is trying to take the burden off of the boards and work directly through your agents, as long as you've given us permission to do that. Our resources obviously start with our website, www.npdb.hrsa.gov. We try to keep all the information on our website current. There is an effort underway right now to revise the look, the feel, the structure, the functionality of the website, so stay tuned for that. Right now, lots of good information there, including, again, information about how to obtain the draft guidebook, and we really are encouraging everyone to take a look at that and provide us feedback. Given that this draft took more than a decade to get out to you, chances are this one's going to be around for a long time as well. Though, I will say, there is some plans to, because it's being put in an electronic format, that we'll be able to update it a bit more regularly than we have done so far. So, again, customer service center number was given earlier, and here we go again, 1-800-767-6732. I'm one of those people where I don't look at the letters that this means, but I understand it means like SOS data bank or something like that. So, you know, somebody was being clever with that. But
SOS NPDB.
SOS NPDB. So that's our help number, or the email is help@npdb.hrsa.gov. So those are our general resources. Over the past 6 to 9 months, we've tried to create technical assistance materials for you. We've done a couple of webinars. We've done some technical assistance videos. So we're trying to be more responsive and accurate with our information. So those things are available, on our website. Check them out. For our contact information, Dave Lowenstein is our branch chief, and his number is 301-443-8263, and he answers his phone. So you want to get right to our chief, there he is. His email is DLOEWENSTEIN@hrsa.gov. We also have a general compliance mailbox if you want to send general comments to dpdbcompliance@hrsa.gov. And then obviously all of you have worked with a compliance officer. Some of us have been around for a few years, and some a few more years, and some of us less than a few years. But I think you probably have had some contact with one or several of us. So if you have direct contact information for any of us, feel free to use it. That's we're here to provide assistance as best as we can to you.
And your compliance officers are listed when you go to your data bank. When you log in, under the compliance page, you will see the name and contact information for your compliance officer there. If you lost it or need to get a hold of them in a different way. Well, thanks again, everybody, for participating. We really appreciate your time, and please don't ever hesitate to contact us.